de membrana limitante interna en edema macular diabético por el doctor Octavio Magalhaes.
Tem que voltar. Buenas tardes. Me chamo Octaviano Magalhaes, sou de Brasília, de São Paulo. Só que eu vou falar em inglês, because the portunhol I think is worse than my English. So we would like to talk to you today about the results of the surgery and internal limitant membrane pills in diabetic macular edema. So you know better than me that these patients have different stages: systemic control, traction, sometimes ischemia, vascular and retinal degeneration. So there is a lot of different disease in this case. And you have these 4 tools to treat these patients: the anti-VEGF, laser, steroids, and surgery. For the anti-VEGF point of view, you know that you have a lot of non-responders to anti-VEGF treatments. You need a lot of many injections. Sometimes you have non-response, resistant, suboptimal response, refractory response, and degenerative macular edema. So it's something that is not really a good treatment for that patient. Laser photocoagulation, you know that the ETDRS results are not so good, and sometimes you can add this treatment to anti-VEGF treatment, and we have a pretty good result in protocol I, diffused laser, as everybody here knows. And how about steroids? You know that steroids sometimes are better in anatomical and functional results, but it's not 100% of results. Some patients don't respond to steroids also. So you have surgery, and we have 2 different surgery, with traction and without traction. With traction, this is the better study that you have, the GRCRNet 2010. They studied 87 eyes with vitreomacular traction, and they performed the peeling in the membrane, epiretinal membrane in 61% of the patient, membrane, internal limitant membrane in 54% of the patient, and you saw decrease of the central retinal thickness of 163 microns in 6 months, 40% less than 250 micrometers, and 50% of these patients have a thickness of the central retina reduction of more than 68% of the patients. So it's a pretty good result. And without traction, you know that I have a lot of small series of cases, some of that the thickness reduction but not increase the visual acuity, and another many series of cases, the thickness reduction and increase the visual acuity. So it's something very difficult to perform the surgery in our patients right now. But the best thing of these results are the recurrency. So you cannot see in these many papers, GRCRNet, so only 26% needs additional treatment. And the other ones, something between 8 to 37 patients. So after surgery, few patients needs more treatment. So it's pretty good for many patients. Many kinds right now, we do or not do peeling of our patients that have the proliferative disease and the edema. So you see a lot of this patient, like this 52 years old male, type 2 diabetic, who's complaining of floaters in 30 days before in the right eye, and you can see this is an old surgery from 2012. And at this time, we performed peeling for 100% of our patients, because in this time, we believe that we did a better job when we removed the internal limitant membrane this old time. So we do a lot of this kind of this patient, and right now, I saw the last time in 2022, the patient had 100 of vision in his right eye, the other eye 26 is pretty good for diabetics. But when I compare 2022 to 2017, you can see that it's decreasing the thickness of the retina, and also the visual acuity become smaller. Worst visual acuity also. The patient was at 20/60 and now 20/100. So it's decreasing the visual acuity also. So I saw my 23 patient of my personal patient, and I mentioned all these patients with a 5 years visit to 10 years visit. And I see a decrease of the thickness of 205 to 145 of central retinal thickness. 88.2% of the patient had less than 200 microns in 10 years. And the best correct visual acuity also decreasing in time. It's other case of a 65 years old man that have a difficult case of macular edema. You can see this reminiscence of subretinal liquid under the fovea. I performed the surgery after the vitreous hemorrhage, and I saw that before this patient and saw that this patient has this liquid, and so I performed the internal limitant peeling, as you can see at this video. And it's you're going to see you don't have any problem at this patient when perform the peeling. And after years, as you see here, you have a good vision. But when you compare 2016 to 2021, you can see right now the thickness of the retina decreasing and losing the internal retina in time. So it's something that we have to look if we need to do in all these patients. So these other patients, 49 years old male, type 1 diabetes, I think this is impossible to perform this surgery without internal limitant peeling because he has a vitreous schizy. It's impossible to remove all distraction if you don't do a very good peeling in this patient. But I performed this patient, I have more than 10 years of postoperatory view, and you can see also a decrease of the visual acuity and also a decrease a little bit of the retinal thickness. So a long-term 10 years of follow-up showed decreased macular thickness and visual acuity after internal limitant peeling in diabetic patients compared to 5 years evolution. Thank you so much.
Muchísimas gracias, doctor Octaviano.